Welcome to this JBI podcast. My name is Terry Olson. I am a quality nurse consultant at Kaiser Permanente, Northern California. I'm a master's prepared clinical nurse specialist with over 40 years of experience in adult critical care, with a few years in neonatal intensive care. As a critical care clinical nurse specialist, I have conducted many high-fidelity simulations in the labor and delivery theaters and in postpartum maternity wards. Thank you for the invitation to share my commentary on the manuscript by Pan and colleagues titled Enhancing Bladder Management for Intrapartum and Postpartum Women at a Maternity Hospital in Taiwan, a Best Practice Implementation Project. Intrapartum and postpartum urinary retention is a multifactorial disorder. Persistent urinary retention can be detrimental and cause irreversible bladder damage, leading to severe sequelae, including infection, chronic dysuria, and renal failure. This can increase the risk of postpartum depression and increase the length of stay in the hospital. A maternity hospital in the northern region of Taiwan implemented a quality improvement activity at a 20-bed ward. The implementation project used the JBI practical application of clinical evidence system and the Getting Research into Practice audit and feedback tool. The baseline overall compliance were identified as follows: absence of routine guidelines, lack of proper training of the nursing staff, and inadequate written materials for nurses and patients. Postpartum urinary retention rate was initially worse during the first implementation phase, from 9.09% to 15.91%. Once the nurses were more comfortable in the study and in expressing their views, the urinary retention rate decreased to 8.51. The project team recognized the importance of nurses in the multidisciplinary team. The group included a nurse midwife to help build rapport with the nursing staff. The relational leadership theory by Clark N. was also utilized to emphasize the importance of all staff members' viewpoints and perspectives. The establishment of a bladder care work group and evidence-based bladder management strategies addressed all identified barriers. Management encouraged professional growth of the staff, while the staff nurses help achieve the organization's goal. This created a shared vision and goals. I would like to acknowledge the team for the meticulous care given to this study. As a clinical nurse specialist, my focus is to improve patient outcomes and cost effectiveness for the organization. I assist with the quality improvement of the nursing staff with education, consultation, and research. This study was conducted on healthy perinatal women over 18 years of age and with no neonatal complications. The hospital did not have a bladder scanner to use in routine bladder management. Perhaps the addition of bladder scanners can assist with early bladder assessments and interventions. Repeat training is required frequently, especially for novice nurses. Seasoned, experienced nurses also need refresher classes, as old, non-evidence-based work habits may have developed over the years. I have found that nurses learn best from other nurses. See one, do one, teach one. Both the novice and seasoned nurses are needed with bedside, just-in-time teachings. Management can support and encourage knowledge exchange and education by adequately staffing enough nurses for all shifts. Making sustainable improvement requires shared accountability and responsibility across the multidisciplinary team. Thank you for this opportunity to examine this best practice implementation project.